Blue collar, white collar, no collar, introverts, extroverts, rise at dawn, out till dawn. Just getting started, seasoned pros, bright eyes and full of wisdom. Now we can all be covered. GetCoveredIllinois.gov is the official place to compare all health plans and find financial support. Welcome to a new state of health.
Very good. Well, some days are called historic, and this one actually is. This is a very special day for health and wellness in the land of Lincoln. I think it's very, very important that we come together. A lot of people, a lot of organizations, good citizens all across our state and across our country came together to pass a law, a very important law, the Affordable Care Act, Obamacare. And today is the first day in our state of Illinois, the home state of President Obama, where we're kicking off the beginning of enrollment in this very important program. We understand with any new program there will be glitches and bumps along the way. That's what happens in any kind of endeavor. When Apple unveils a new device, they may have some minor problems, glitches that need to be resolved, but they go forward. They don't just stop and say, well, we're going to take a year off. They understand how important it is to carry out the mission. And that's what we're going to do here in Illinois. We know that we, the people, and that's who this is all about, the people of Illinois, the everyday people who live from check to check, who want to have decent coverage, who understand that the best thing we could possibly do in our state is have health and wellness for everybody. I walked across Illinois 12 years ago. I started on the bridge above the Mississippi River in Rock Island, Illinois, the Centennial Bridge. I was with my doctor, Quentin Young, who was the physician of Dr. Martin Luther King when he lived in Illinois in 1966. And Dr. Young and I were walking for decent health care for everybody. And we walked all across our state, all the way to Chicago and Lake Michigan. And we met a lot of people along the way who did not have decent health care, who had no health coverage whatsoever. And that's why today is such a special day. We're going to be implementing a law together with the federal government that will make a difference in the lives of literally hundreds of thousands of people all across our state. We'll help everybody because our state and the people of our state believe that we're a community. We're not a crowd of 13 million people, everyone going in their own separate direction. We believe in community. We believe in the common good. We believe that everybody's in and nobody's left out. And that's what this law is all about today. That's what this mission is all about. It's a grassroots organizing mission where we have to work together, help our neighbors, help folks that we work with and folks that we know and their relatives. It's all about us working together, and we can do this together. And I think it's very important that our website, people know what it is. It's getcoveredillinois.gov. It's important that we keep repeating that. Matter of fact, we ran an ad in the paper today about the website, and we'll keep doing it for quite some time in order to help get folks enrolled and learn about this program. Education is really important for every single person in our state. This is the official health marketplace. I think it's very important we know that this is run by the government of the people of Illinois, the state government, and we're going to have a new state of health care in Illinois that emphasizes things like prevention. I just want to read some of the coverage areas of any of the programs and insurance policies in this. It includes doctor visits, hospital stays, maternity care, emergency room visits, mental health services, chronic disease management, prescriptions, and much more. Nobody is going to be denied coverage because they're sick or they have a pre-existing condition. And those conditions can include asthma and diabetes, HIV, cancer. We're not going to deny anybody. We don't believe in that. We believe that health care is a fundamental right. It's not a privilege, it's a fundamental right. And Dr. King, when he lived in Illinois in 1966, said exactly that. He said it's so important that we end discrimination in healthcare, that we make sure everybody is included.
As Governor Quinn said, today truly is a historic day, and it's an important day. It is important for millions of people in Illinois, both those who are uninsured and those of us who know and love someone who does not currently have the protection of health insurance. And we've heard today exactly how important that protection really is. I want to just take a second to acknowledge and to thank all of the people and all of the effort that has gone into making today a reality. Both the staff within state government who have worked for months, years, and literally around the clock, and our partners and our supporters outside of state government. This really has been a group, a team effort. And today, the education can begin, people can begin the learning process, and they can start taking the first steps to actually getting health insurance coverage, which will begin January 1st. So I wanted to just walk people very quickly through our website, which you've heard today is getcoveredillinois.gov. On the website, you can access a database of trained navigators who will be able to help you in person for free. And in addition, you can access a series of frequently asked questions, which under Get Answers at the top, and a glossary of common health terms and local events. And I want to say that there are fact sheets and information available in different languages, and people can also access an in-person counselor or search for an in-person counselor or call our call center and get information in Spanish and other languages as well. Most importantly, at Get Covered Illinois, there is a screening tool that will direct people to the right resource and tell them what type of coverage they could be eligible for. So down there when you say see your options, this is the beginning of our screening tool. We focused on making it very user-friendly. People walk you through some very basic questions step by step, and at the end it will tell you what type of coverage you're eligible for, and there will be a link to the right place to go, whether our benefit eligibility system, if they're eligible for Medicaid, or to the health insurance marketplace for the people who will have access to that private coverage.
Every year in this country, there are 900,000 heart attacks that occur, and another 800,000 people suffer a stroke. In Illinois alone, this year, 35,000 people or more will die from cardiovascular diseases. And unfortunately, the burden of those deaths and those heart attacks and strokes falls disproportionately on people who have lower socioeconomic status, people who typically can't afford to see a doctor or access the healthcare system because they don't have healthcare coverage. Now, when it comes to heart attacks and strokes, we actually know an awful lot about how to prevent those diseases. And in fact, some people estimate we could prevent up to 90% of the heart attacks and strokes that occur because we know what causes them. It's things like cholesterol and blood pressure and diabetes and smoking status, poor diet and sedentary lifestyles. And I'm sure those all sound familiar to many of you in the room. But the thing is, if we want to prevent those things, we have to get people to get together with their doctor, to measure their numbers, and to put together a prevention plan that will allow them to adopt healthier lifestyles, and when they need it, to take medications so that they control those risk factors. Now, on the way over here today, I was thinking about a patient of mine that I met recently. He's a 29-year-old young man, and I met him in the emergency room when he was in the middle of a massive heart attack at 29. And he told me that just 6 months earlier, he had actually also suffered a stroke. And the reason for that was that he had lost his job, and he had lost his health care coverage, and he couldn't afford the very simple blood pressure medications that likely would have prevented both that stroke and that heart attack. So for me, today's a really important day because when I think about patients like him, young patients who are at risk for heart disease and stroke, he's the kind of guy who can now get back into coverage, get the medications he needs to prevent these diseases, and get the whole state moving forward. So today, up to 1 million people in Illinois may have the opportunity to opt in and get better health care, preserve their heart health, and save lives and live fuller and more productive lives.
Well
Thank
said.
you.
Thank you, Doctor. Thank you for good service. Very good. And what Doctor just said, getcoveredillinois.gov. That's our website. It's the official health marketplace. It's very important that everyone understand this is official, and this is the way you can access information. You can also make a call to a toll-free number, as well as visits as well.
I've had some good days and I've had some bad days, but occasionally I have a great day, and let me just tell you, here in Illinois, this is a great day. This is a day that's been long in coming. As a 30-year battle-scarred, sometimes battle-weary veteran of health care reform, this is a day that I always knew would come. You see, we believe that every human being has equal worth, and we also believe that every human being is entitled to live a meaningful and fulfilling life. But beyond our own individual concerns, there is a common good that prioritizes community, and thus we believe that government should be used as an instrument to promote that community and that sense of common good. And look at this, all of us pulling together. Barney Frank once said, governor is the thing that we all do together. The governor, elected officials, healthcare professionals, activists, labor, everybody pulling together. They can only win if they divide us, but we can win if we all work together. We all do better when we all do better. And while some attempt to delay and obstruct and deny and repeal, we are not going back. In Illinois, we're going forward. No more will we be having pre-existing conditions if you have a health care illness. No more will we be putting people into high-cost emergency room care instead of low-cost preventative health care. We're going forward. No more will we be denying people if you get too sick, going bankrupt if you have too much of a big illness. No longer will we have lifetime minimums. Those days are long gone, and I want to thank this governor, long before it was popular, for walking all across this state, telling people that this day would come. I thought I was the biggest optimist. He is one of the biggest optimists in the world, and his day is finally here, and he deserves a great big round of applause. We all are going to get covered. Let's get covered, Illinois.
All right. Very good. Thank you, Bill.